About 70% of out-of-hospital cardiac arrests happen in homes, according to the American Heart Association. National CPR Awareness Week is underway across the U.S. and serves as a reminder that we can all learn the skills that could help save the life of someone we know or even a stranger. Wardell Seals Jr. is the CEO and president of Heartbeat CPR here in Memphis, and he's here to share some of those life-saving techniques that his company teaches others in the community. Thank you so much. What a setup here.
Thank you. Thank you so much for having me.
Okay, so you understand the importance of people learning CPR and just having it be second nature. Tell us about the importance.
The importance is everyone always thinks they have to be trained to learn how to save a life. We say save a life versus CPR, and you do not. Just having the basic knowledge, and like you said, 70% of people that are in cardiac arrest occurs outside of the hospital. And me, as working as a paramedic firefighter, retired now, we always will see people when we pull up on the scene, no one knowing what to do. And that's what got me an interest 30 years ago to get in business, is training people how to save a life. Just doing just the basic, not trying to get certified, but just doing what we have now. The American Heart Association has hands-only CPR.
I saw this, yeah. When I was a kid, it was different. Okay, so let's talk about the signs and symptoms, and then I want to see this demonstration.
Right. One of the signs and symptoms of having a heart attack could be chest pains, difficulty breathing, where the heart is losing blood flow. They could be having a heart attack, difficulty breathing, even a toothache with chest pains.
Wait, a toothache with chest pains?
Toothache with chest pains could be a sign of having a heart attack. People that are constipated, sleep apnea, could be one of those signs that you can make you have a heart attack. And we have to realize that we have those cardiovascular risk factors. If you have a family history of heart disease, you have a stroke, family history of stroke, diabetes, high blood pressure, it could be one of those signs that you might be having a heart attack.
All right, let's see what you want us to know about saving lives.
Right, and we have to understand, Kanji, that our body is just like a vehicle. If the engine is running, and they're not breathing, they just need the gas, right?
Okay.
But if the engine's not running, back in the old days, we had to press that accelerator.
Right.
Is that right? So the American Heart Association, with the hands only, if you see someone that's unconscious and they're not breathing, and you're so afraid to give the breath, and you know that they're not having a heartbeat, I tell people, if you take 4 fingers right up under the armpit, it come across to the center of the chest, of course your victim will be a lot lower than this, and just begin to do hard and fast chest compressions. Hard and fast chest compressions.
You're almost mimicking the beating of the heart?
Right, and it's almost like the song Stand Alive.
Oh,
just 1, 2, 3, 4, stand alive, stand alive. 1, 2, 3. Now don't get caught up and go, stand alive.
That might be kind of rude.
Yeah, absolutely. So even on the infant, it is the same thing. The American Heart Association want us to do what we call the circle of thumb technique. We have some people that might have arthritis. So we teach a very easy technique. It's with the 2 fingers. On the 1-year-old, press hard and fast.
It seems hard.
No, it's really not.
Okay.
It's like I say, most of these mannequins that we have now are lifelike.
All right, gotcha.
Try to press.
Oh, and I have my little nails on too.
Yeah, don't worry about breaking a nail. We have money. We can.
Oh, okay. Look who's paying for my next manicure. I'm going to get the highest one.
Oh, as usual. So try this one.
Okay. Yeah. My little cord.
Yes. So take 4 of your fingers.
Okay.
Under here, come straight across.
4 fingers.
Come straight across.
And then put my little heel in there.
And just press hard. Of course, it's a lot easier when the patient is down low.
Yeah.
Okay.
I got it.
Yeah.
And how many, is there a number of times, do you just keep going?
Well, the American Heart Association say you want to do 30 compressions, and then, like I say, you stop and do it again until we as paramedics get on the scene.
Okay, 30, pause, breathe. Okay. And then what is this concoction over here?
This right here, see, people have heart attacks and they go into cardiac arrest. This is what we call an AED defibrillator, or I say, hey, it's the shocker. Okay, the thing that shocks the heart. You tell someone, hey, grab the AED. What is an AED? The thing that shocks the heart. They know what it is. So this machine right here will only shock you when the heart is in cardiac arrest or fibrillating. There's no electrical activity. And so all you do is turn it on, it will start talking to you. It's going to tell you everything what you want to do.
Okay, well, you have an event coming up.
Remove all clothing.
I don't want to miss that, lose out our time. Can you just talk about well, were you finished with that?
Yes.
Okay, good. Okay. So this event that's coming up Saturday. Okay, you're inviting people.
We're inviting people. We have what we call, since the CPR week, we have an event that we're having a special rate where you can call the office at 901-262-0002 and speak to my assistant, Miss Gray, and she will get you signed up for that event.
Okay. Do you work with businesses also?
Absolutely.
Like just go to their
if they have at least 5 people, we'll come out to their business and do it.
Okay. What's that?
This right here is Narcan.
Okay.
Narcan is used for the opioid overdose.
Okay.
Very simple to use. We tell people you can purchase this now at CVS and Walgreens now. And what it will do, it will reverse someone that has an overdose. It tells you very simple, insert it into the nose, tilt the head back, and use it.
All right. Thank you so much for helping people in their homes save their loved ones.